This patient, if you just comment, this was patient number 7, patient with late stage melanoma, and what we see there is a field of lesions. There's a couple of dominant lesions in the picture, and then there's a whole field of lesions that are diffusely scattered throughout that network of skin and lymphatics. When we treat it, we treated, you can see those spots. That's what we treated. But what we saw after only the first week is not only did the lesions respond, and again, as Dr. Rojas had indicated, this was not, we didn't burn them or ablate them, or we treated them with moderate heat. We saw this regional response. Now, this regional response, the technical definition of an abscopal response is response in a tumor that wasn't directly treated. And so the reason the immune assumption that's happening here is that response in those other lesions is generated from the immunity that was triggered by the treated lesions. Dr. Rojas, could I ask you, when you see this, what is, and I value your honest opinion, what is your interpretation of that response at 7 days?
No, this is clear enough scopal response that it's similar to that was being looking, for example, with intratumoral virus, oncolytic virus. The effect that there's a lot of evidence that show that the lesion treated had some change in the in the in the microambient, the tumoral microambient, and I think that we're seeing something similar with this. And in some cases, for example, and one of the questions about that is asking about patient 3. We didn't saw response locally in the lesion that we treat. The evaluation was made by biopsy. No, it's not a CAT scan. So if we put there that we didn't saw response, is because the tumor was still there. But of course, we are not seeing or looking what is happening with the immune system of that patient with this treatment. And for example, in that case, if the patient is still ongoing and no progressing and with no other treatment, in this case, because this patient was out of IO in that moment, just on palliative care, of course, I think that is some an example of some clinical distant abscopal effect. This is local. Is really near from the lesion, but in that case, for example, I don't have any other explanation to see what were happening because the patient was previously progressing. I think that this is a good hypothesis, and like David said, like Carmen said, and like I previously said, we're seeing response locally more than we were hoping, and also near to the tumor but not treated, and also in some cases more distance.
Yeah.
So I think that this is a good therapy doing some immunomodulation. And in that case, I think that we have a strong hypothesis to try to go further with using this with another kind of treatments like other drugs.
I couldn't agree more. And so we just show this. We put this slide up for contrast, just so the viewers can see. It's quite remarkable. I mean, as a treater, when we see this, we're taken aback a little bit that this is after 1 week after the second treatment or 2 weeks after the initiation without the addition of drug, just as a monotherapy.